I'm glad to be joined by Raj and Dr. Tracy here today. Excited to talk a little bit about what you're doing and your solutions that you're bringing and the problems you're trying to solve. But let's start with some introductions. Tell us a little bit more about yourselves. Raj, I'll start with you.
Great. As you can see, I play guitar a little bit on the side. My name is Raj Amin. I'm CEO, co-founder here at Arcade. I've got a background actually in consumer technology originally and entertainment, and then moved into healthcare about almost 15 years ago, building companies around consumer health education and really now moving into the mental health space, focusing on how can we bring more consumer experience to how we treat mental health care issues.
That's great. It's always, I see more and more people who have sort of a non-traditional background bringing their expertise from outside healthcare to health, which I think definitely is needed. So glad to hear your story as well. And Dr. Tracy?
Thanks, Sonia. I'm Tracy Dennis Tuari, and I'm co-founder with Raj, also Chief Science Officer of Arcade. My background's in clinical psychology, so I was trained as a clinical psychologist. I retrained in cognitive neuroscience, and I really went right into being an academic and a researcher. And it's my research over the past 15 years that forms the core of our products, our therapeutic games that we'll be telling you about in just a second.
That's really exciting. Can't wait to dig into that a little bit more. So I always like to start with the why. So what is it that you're looking to solve? What is your why in your building of the solutions that you have?
Yeah. Well, I mean, the biggest why for us is that the people that need treatment aren't getting the treatment that they need, right? And we know that there's a huge number of barriers to getting people on the right path in mental health. And those can be everything from stigma to the fact that 70% of mental health issues are showing up at primary care and OBGYNs. And people get lost in the wait, and they get lost in the system finding the treatment that they need. And so there aren't enough treatments available at that front edge. And this is where digital therapeutics really can come in and add a lot more scale to how we treat the early side of that mental health care journey. And so that today is about a $300 billion problem in the US alone and about $1 trillion nationally of the cost of untreated mental health conditions. So what we constantly hear, and as we work with different types of clients, whether that's universities or behavioral health providers, is that a lot of times the people who have escalated needs never even make it into the system. And this is where these digital products can really be helpful to be integrated into the way the care is delivered, so that we get to those people earlier. We can identify the people who need to be escalated. We can give treatment to those who may have more moderate needs, but then really make space for the people who need escalated care. And so our products really fit into that problem space of getting people engaged earlier, getting some of the data out also that helps to escalate and triage care as well.
So that supply-demand problem at its core with mental health right now. There's so much need, and we just don't have enough people to give them like one-on-one, in-person sort of solutions. So this is alternative therapies to address that and create engagement.
That's right. And the good news is that the industry is sort of catching up to this need with the release of some of the new codes around digital mental health treatment put out just at the end of last year, starting this year, really recognizes at the level of CMS that we've got to have digital treatments available. They need to be reimbursed in scale in order to address this problem. And so that's very exciting and a great tailwind, certainly for products like ours in the marketplace.
Yeah, I'll also add that there's also not just a lack of access to care, but care that is clinically validated, evidence-based care. So, we're very much a science-first company. And so we really, from our inception, know that we cannot give people snake oil. We need to give them the best, absolutely best scientifically validated treatments out there.
That's so important because there's so many things that you find on the market that may or may not be clinically validated. So tell us about what your solution is, what makes it different, because you have a very unique name with AVIA Therapeutics. Tell us more about all of that.
Yep.
Yeah,
Should
so
I jump in
let
another
me
time?
actually,
Yeah, do you want to? Oh, okay.
I'm just going to share a little bit. Wait, well, okay, here we go. So yeah, I mean, one of the big things that makes us different, you called out our name, Arcade. We are leveraging gaming as a modality because gaming is naturally engaging. And so we're building engaging, low stigma games that can be deployed as digital therapeutics. They're evidence-based. So as Tracy said, we put science at the core of everything we do. And so these are based on real evidence and real clinical trials. And they can be used both as complementary treatments as well as first-line treatments. So really, we're all about how do we integrate with the way care is delivered with providers into their workflows so that these products can be easily used, as a front line of care. And so, just in terms of gaming, what makes us different in gaming is gaming has exploded in popularity. It's 2/3 of Americans actually play video games regularly. What you may not realize is that the most popular type of game is actually the games we play on our phones. And these kind of mobile casual games are ones that are very easy to use. We're kind of already almost self-medicating, whether it's, you're playing Candy Crush or Wordle or other games on your phone. These are the simple, highly accessible games that you see people playing, in line, at the bank, on the subways, etc. And they're actually skewing somewhat older. So in fact, the center of the demographic is actually slightly skewing female and about 50 years old. So these aren't just,
Right?
yeah, it's a surprising stat. But, when you think about it, these games have been around for decades, but they're simple, casual mobile games. It's not the kind of shooter games that we think about when we think about console games. These are, the more simple games that are on your phone that people use to relax. The difference is what we've done is actually embed our treatment into that type of game.
Okay.
And so that's what we've created with our product that we've released, which is called Star Starter for Anxiety, which is a treatment for managing anxiety symptoms. This is backed by some of the clinical studies that Tracy's run, and which we'll talk about. But it really takes this core research that Tracy's done around attention bias modification, which we'll talk about, and embeds that inside of a game format.
So why don't I tell people a little bit about attention bias modification? So this, and I'll just call it ABM for short. It's a bit of a mouthful, but ABM is actually a digital native intervention that we psychologists and psychiatrists have been studying for 25 years. And what this technique does, it's sort of under this rubric of cognitive therapy, but it's very different than the traditional cognitive behavioral therapy that we get in a clinic. What it does is it targets unconscious habits of thinking that we know drive a whole range of mental health problems. Anxiety is one of the big ones, but also depression, addiction, and others. And so in anxiety, for example, we have this unconscious habit of paying too much attention to the negative, to things that are potentially threatening, right? Or, and maybe aren't threatening yet, but they might be. And, we get really stuck on that. And we get so stuck in paying attention to that negativity that we lose the chance and the flexibility to notice all the good things around us, to notice that there's safety cues or there's something positive in our environment, a good opportunity. So when we get locked into this threat bias, that really drives the vicious cycle of anxiety. So what attention bias does is it triggers that bias and it retrains it so that now we're disengaging more from the negative. In the case of Star Starter, our anxiety game, we're disengaging from the negative and we're learning to more flexibly seek out positive information around us. So that's, and that's a very complementary thing to what traditional cognitive behavioral therapy does, which tends to focus on conscious ways of thinking, things that we can, irrational thoughts or, catastrophizing or different kinds of patterns of thinking. We're dealing with the subconscious, whereas CBT is dealing more with the conscious. It's also a brief intervention, so it makes it a great fit for a casual mobile game.
And you had mentioned, I see it on this page, and you mentioned earlier, low stigma games. Can you explain what those mean?
What we mean in part is that when you put anything in a game, it reduces stigma. So we know that one thing, the big thing perhaps that stops people from seeking help is this stigma around mental illness, that we're ashamed, that we're embarrassed, we think it means we're broken. By putting this validated intervention in a game, what we're signaling really is that this is something that isn't to be ashamed of. It's something that can be in your pocket, right? That this tool for working through this habit of attention doesn't have to mean that you are ashamed of what you're experiencing. So what we're really trying to do through gamification, through having something be mobile and casual on the go, is we're really trying to break that stigma that keeps people from seeking the first help they need.
Thank you.
We have lots of evidence. I'll just briefly, I mean, people who are data nerds can will have fun with this slide, but I'll just briefly say that we have run, in addition to 7 randomized clinical trials on this technique, we ran a recent pilot trial with socially anxious individuals using our anxiety product, Star Starter. And what we found is that a huge proportion of the folks in our trial benefited. So 90% of folks showed some benefit, but then you want to see, is that statistically significant, and is that clinically meaningful? We found that it was a statistical difference compared to a placebo version of the game. So this is placebo controlled, a randomized trial. We had on average a 33% decrease in clinical social anxiety symptoms, and 68% of participants showed this meaningful drop, meaning a whole clinical severity level in their experience of social anxiety after just a month of using this game for about 12 minutes a day, a few days a week. So this really is a brief micro intervention. We even saw that 38% of people in our active condition went below subclinical levels of social anxiety symptoms, even though they all came in with clinical levels. So this is a 3x, kind of magnitude of effect compared to the placebo. So it's not just that this is happening in a vacuum, we don't have any comparison. We're actually comparing these effects to a placebo version of the very same game.
Very interesting. And so the games itself you don't get the same effect by playing any game. Like you don't get the same effect by playing Wordle. The games are engineered to address the conditions, the subconscious conditions that you were talking about. Correct. And what is the workflow for a health system or clinic who's interested in it? How does it work? Does the clinician prescribe this to a patient? How do they monitor the results?
Yeah, no, great question. I mean, as you know, workflow is so critical in these equations. We've tried to make it, very easy. So we've worked with provider partners and enterprise partners to create specific invite codes that allow patients to opt in to, HIPAA consent for data to flow to providers. We have a back end system that we've built so that that data can be passed off, both for the purposes of triage as well as for billing support. So there are multiple codes that can be used, and we've actually found this is actually interesting in that there's different models under which partners seem to want to deploy the product. In some cases, there are more kind of self-pay options where perhaps the provider, we can provide a discount code for the provider to offer this to their patients with a discount, where the patient pays for it, since a lot of behavioral health is in the self-care world. In other scenarios, which I think is what really we're excited about, is with the new codes coming from CMS and with RTM codes available, providing data that allows for billing of both RTM and digital mental health treatments is really an expanded opportunity for revenue generation that's great for providers, but also really great for patients because they won't have to pay. And then so those models, we get reimbursed through the reimbursement streams that are covered through both RTM and digital mental health treatment. And so that back end system is what supports that. Again, we try to make it very easy for the patient. So all they have to do, they can literally scan a QR code, even have exam cards that can be used. And so provider can hand them an exam card, scan a QR code, they get registered, they download the app, and they're off to the races. Any kind of assessments that we do are integrated in the app. So there's PHQ-2, GAD-2, there's social phobia score as well, that come back into the dashboard, as well as usage information as well.
And then the provider can see and track how their patients are doing. So they have a view to see how their patients might be doing, or how does that work?
That's right. Yeah, no, so there's a provider log in, or we can API the data,
Okay.
send it back out to whatever other systems that providers are using, so that certainly with large health systems, they don't want to open up a new interface. So
Right.
being able to send the data seamlessly is important for those larger clients as well. But we do have a dashboard that providers can look at if they want.
That's a really important piece, because I think as much as the digital therapeutics exist, the providers want to see, is this working for my patients? Which patients are using it? How is it changing their course of treatment and so on? So this is really great. I know there's probably so much more to talk about, but we're almost out of time. Is there anything else you'd like to leave us with in terms of sharing more about the product, what's coming, or anything else you'd like to highlight?
Yeah, I mean, just I think that the time is now. I mean, we know that these products are coming, and we do have an anxiety game available right now that is doesn't require a prescription, so it is available to manage anxiety symptoms. It's available.
Anybody could download this and
So it's through a partner. So it's not, we don't make it available direct to consumer at this point.
Okay.
So it would need to be through one of our healthcare
Okay.
provider partners, but we are working with a variety of organizations, colleges and universities. We're even working with some correctional facilities as well. So like really thinking broadly about where we can attack the problem and give people a starting point to self-care that's low stigma and effective. And then next year we have won we've been co-awarded a $3.8 million grant from the NIMH, which is
Congratulations.
the clinical trial for our depression product. And so that's very exciting, because obviously, it's a much more serious condition. That will be prescription only product. And our intended availability for that is 2026. But the good news is we can start now with an anxiety product that's proven to be effective, and get our partners ready for the future, when a lot more products will be available as well to help their patients.
Very helpful to hear, and congratulations on that grant. Thank you for walking us through this. I think it's such an important problem, and it's always great to hear from innovative solutions like yourself, so that the health systems in AVIA's network can find more and more options to address some of these critical needs. So thank you both for your time, and kudos on the work, and
Thank you so much.
good luck with everything ahead.
Thank you so much.
Thank you, Sonia.